Welcome to Food for Thought. This is a webinar series where we're elevating topics relative to diversity, equity, and inclusion. Today, we're talking about a topic that is near and dear to my heart. We are covering Hispanic Heritage Month. I am honored and privileged today to be joined by Dr. Del Castillo and Dr. Garcia, two members of the Sanford family representing the Hispanic community. Dr. Del Castillo, Dr. Garcia, why don't you go ahead and introduce yourselves quickly for our audience? I'll start with you, Dr. Garcia.
Well, is it okay, Tasha? I would just let the ladies go first.
Absolutely, that is very kind of you. Dr. Del Castillo, why don't you go ahead?
So I am Cinthya Del Castillo. I was born in Ecuador and I grew up in Florida. And I'm a pediatrician. I do mostly outpatients and I'm working at the MD2 Pediatrics Clinic.
Awesome. Thank you so much for your time and joining us for this conversation today and for being a part of Sanford. Dr. Garcia?
Yeah, thank you, Tasha. First of all, thank you for the opportunity to participate on this webcast. And honored to join this webcast with Dr. Del Castillo. Cinthya, nice to see you. My name is Luis Garcia. I am a physician for Sanford. I am a surgeon, and I also hold the position of the president of the medical group. I was born in Mexico City, transitioned for my professional career into the United States. I have been employed by Sanford for nearly 20 years.
Wow. Well, thank you for your dedication to the health system. 20 years is quite the commitment. Very honored, that both of you are taking some time to talk with me a little bit about Hispanic Heritage Month. I can only ever speak from my own lived experience, but I've always felt an incredible amount of pride in my Hispanic heritage growing up. I'd love to hear just a little bit about your guys' backgrounds. Dr. Garcia, if it's okay, I'll start with you. You talked a little bit about Mexico City. Do you want to share just a little bit about your upbringing, your childhood in Mexico, and that journey to Sanford?
Yeah, thank you, Tasha. Yeah, as I said, I was born in Mexico City. I don't know if you're aware, but Mexico City is one of the largest cities in the world. If I'm not mistaken, right now the population is about 20 million people. And I was born in a very poor neighborhood in Mexico City. As a matter of fact, if you go right now to that neighborhood, it's perhaps one of the most challenging and most dangerous neighborhoods in the city. But my father was a leadership figure in the community. He was the only physician for a long time, and he had the opportunity to start a small hospital that right now is a very important hospital in that area. He is a physician. My mother has an accounting background. And at the time when we were little, she decided to stay at home, and eventually she joined my father as and running all the finances of the business. But all this to tell you that as I grew up, I was exposed to two different worlds. One was the world of poverty, where I just needed to look at my surroundings to understand what need looked like. And on the flip side, I was exposed to what success meant. Both my father and my mother were extreme figures for me. And for them, three things were important. One, and in that order, it was about family. You mentioned what it is to be part of the Sanford family. That is something that was important for them. The second one was education, and they were very, very strong on that concept. And I honestly owe all my success to them because of those roots that they generated on me. And the third one was a sense of community, of always giving back, of always looking after the people in need and helping others. And I tell you, I did not have a reason why not to excel and not to be successful. I observed both my mother and my father being great role models. I grew up in the medical field. I loved going to the hospital when I was little, and even if it was just to clean a bathroom, I just loved it. And eventually that transitioned into me getting into the medical career. Did my medical school in Mexico City. I got to be honest, you know, I was destined to be by my father, practicing with him. And it was just exposure to the American medicine, what was a delight for me doing my last year of medical school in Miami and then eventually my residency here. I know when I joined the Dakotas for my residency and intern into my practice, people ask me, why did you stay? And I tell you why I stayed. These are great communities. These are great people. The quality of life, the quality of people. It doesn't matter what you have or who you are. It doesn't matter what you have or what credentials you have. It's truly about who you are as a person, what matters. And Sanford has given me the opportunity not only to excel as a physician and as a leader, but truly to live the life of helping each other, of elevating those in need, and to having meaningful interactions with members of the community.
Yeah. Well, that's an incredible story, Dr. Garcia. I'm just so appreciative of your willingness to share that, you know, with our Sanford health system. I think it's incredibly important. That juxtaposition that you talked about, you know, the two different worlds that you had exposure to certainly resonates with me, and just really appreciate your voice. You know, you mentioned that you had some time in Miami, and I know Dr. Del Castillo, you mentioned time in Florida, so we'll use that to transition. You know, Hispanic individuals are underrepresented in medicine. It's one of the reasons I feel fortunate to spend this time, you know, today with the both of you. Even more so though, Hispanic women or Latinas are underrepresented in medicine. It's estimated that only 2.4% of the physician profession identifies as Latina. And so Dr. Del Castillo, I'm curious if you could share a little bit about your experience in becoming a physician. Are there silver linings or positive reflections that you would share with others that are looking to pursue medicine or find themselves in the field?
Yeah, of course. I think that in life, you know, every challenge is a learning opportunity too. So, you know, sometimes the quote unquote bad things are actually ending up being better things for you. So I think that being trained in Ecuador gave me a different outlook in what medicine is in different countries. Just like Dr. Garcia, you can see, you know, in hospitals, the lack of saline, that patients have to go and buy their own medicine, like even things like morphine in the ER, you know, in the hospital that I trained in when I was doing my medical school, we had to give them a prescription so that they go and buy the fluids, or, you know, basic things. We didn't have gloves. So when you have exposure in the American system, you know, my family moved in '98, so I had exposure to both. I did my undergrad here, and I did some volunteer work in the hospitals here, and I was able to see the great disparity of living in, just because you live in a different country, you have this versus this. So I think that training in Ecuador made me also want to help more, maybe. Like, my outlook has always been like working in rural, underserved areas. Since I graduated from residency in the past 5 years, I've mostly worked in remote places, like that I had to take a plane, drive 2 hours, get to the town, be the only doctor there, and talk to the yard, talk to, you know, different attendings. So I feel that there's always a silver lining in that. You can learn from your background, and and the language too, of course. You know, you get to reach other people that normally you wouldn't have the access to, or adherence as well. So I can say that too, that you also feel in disadvantage when you graduate from a foreign medical school, but I can say that if you work hard enough, if you study for your steps, if you dedicate the time, you're able to match in any program, like any US US graduate. So, you know, there's, with sacrifice, you always see the payoff,
Yeah.
no matter what your background is.
I love that. And I love that that's, you know, your outlook and how your lived experience has really informed how you show up here at Sanford. I really appreciate both of your willingness to share. I know that those questions are deeply personal, right? They're about your lived experiences. Now, though, we'll transition the conversation to some of the health disparities that we know exist for the Hispanic population. You know, recently I was putting together a presentation for a diabetes symposium, and the statistics that I pulled together were kind of stark. The CDC observed nearly a 12% rate of diabetes in the Hispanic population, and that's compared to 7% of the Caucasian or non-Hispanic population. I've personally, you know, lost my grandmother and 2 aunts to uncontrolled diabetes. So I've personally felt the impact of some of the health disparities that I've seen in literature. I'm curious if you could both share just a little bit about your own experiences with health disparities, what you've observed, and really your role in combating some of them. Dr. Del Castillo, we can start with you. I know we've featured you in the ways that you reach our Spanish-speaking population here in Sioux Falls.
Yeah, so you know, I trained a lot in Miami, so I wasn't exposed too much to the disparity because we have a lot of Spanish-speaking doctors there, but I truly felt the disparity like working in other places out of Miami. And one of them actually was here. I had a patient that was seen in another healthcare system in Minneapolis or Minnesota. They traveled an hour and a half here because they had seen like 3 or 4 doctors for a baby that wouldn't stop crying. And the answer was as simple as the baby was hungry and she needed more food. And as soon as they started supplementing, like 24 hours later, when I followed up on them, the baby had stopped crying, and then they came back again and the baby gained weight. And I looked at the notes and I was so impressed. Like, they used translators. They saw them in the ED, a pediatrician saw them, and just a little thing like language made a difference.
Mm-hmm.
Sorry,
Yeah.
I don't know what happened to my computer. Okay.
Okay.
So, yeah, so I can see that language is a big barrier. No matter how much we, like, I mean, we're advancing a lot. In the 80s. There was no translators. People that didn't have the language were in trouble, basically. We learned a lot about complications and all that, but I feel that Sanford is making a great effort in that. My office has 2 receptionists in my clinic that speak Spanish. We have an LPN that knows Spanish as well, and she can communicate with my Spanish-speaking patients. So, you know, we're trying
That's
to.
Amazing.
Mm-hmm.
Yeah, that's incredible progress. I love that you shared that. You know, it's not just the physician overcoming some of those barriers, but also that wraparound support staff that's meeting those needs and breaking down those barriers to build trust, you know, genuine trust in the community. Dr. Garcia, I think you might have a little bit different of a take, you know, being that your background, you know, you're a surgeon. Do you want to share just a little bit from your perspective?
Yeah, you know, I think I'd like to share some of the systematic challenges that we face. If you think about it, Tasha, when we think about the Hispanic population as a system, we think there's a difference between that patient that is a Hispanic American that was born in this country, and those that come as immigrants to our facilities. You know, as Dr. Del Castillo articulated, one of the biggest challenges, of course, is the language barrier, right? And sometimes little things can matter a lot when you have that barrier. But if you also think about it, there's level of income challenges, there's demographic challenges of the Hispanic population being in more rural settings, and the problems disproportionately affect the rural setting more than they do the urban settings. Something that I think a lot of people do not understand are the cultural differences between the Hispanic culture and others. Traditionally, Hispanics are not educated on getting preventative health. You know, the approach is more towards you have a problem, go to the doctor or go to the emergency room. The utilization of the emergency room is significantly higher from Hispanics in comparison to others. So we have a lot of opportunity on getting that population sector to understand the value of prevention and getting really routine healthcare rather than reactionary to a catastrophic event. And one of the things that I want to highlight, you touch base on diabetes, but if you think about it, the root cause of many of the problems that we have right now as human beings is obesity. You know, obesity affects diabetes, cholesterol, hypertension, heart attacks, strokes, etc., etc. And obesity is more prevalent in the Hispanic population. And sadly to say, it is affecting the pediatric Hispanic population at disproportionate rates. So those are some of the challenges that I can speak about. And, you know, I like to go back to a comment that Dr. Castillo said about, you know, don't let your barriers define you, right? I mean, she talked a little bit about working hard and achieving your goals. The same applies to our communities and to any Hispanic. You know, don't let the stigma of being a Hispanic affect who you are. You know, whether it is on reaching for help or getting healthcare or becoming a successful person in the community, it is who you are, what defines you, not what others feel that of what you are, if that makes sense.
Absolutely. You know, one of the things that you said, Dr. Garcia, that really stuck out to me was how some of this can be compounded in rural settings. Dr. Del Castillo kind of alluded to it, you know, her experience in Miami, there were many Spanish-speaking physicians. You know, it would not be as big of a barrier to find a physician that you can communicate in your first language with there, right? But then you go to a more rural setting and the disparity in access to a bilingual physician does grow. I'd like to just transition the conversation again because you mentioned the rural setting and some of the unique barriers. Not too long ago, I saw a LinkedIn post that you shared, Dr. Garcia, where you detailed some medical work that you were a part of abroad and providing surgical services in Guatemala. Can you share a little bit more about that experience and how Sanford has supported you? It looks like a really great example of the medical community aligning with social and community needs to build that trust between the medical community and the community.
Yeah, Tasha, let me tell you, I spoke a little bit about the values that my family injected on me. And I think those values have been only strengthened by the organization that I work for. You know, Sanford is committed to our patients, no matter where you're at, whether you are getting care from a tertiary facility or you're in the most rural, remote setting. We're there for you. We're committed to you. We have made a promise to bring the best healthcare to your doorstep. And that's why we are the premier rural healthcare delivery system in the nation. And that's why we are the most trusted healthcare system in all the markets that we touch. So translating those values and that mission into what you articulated, I have had the privilege to give back, you know, and to me, one of the best ways that I can give back is by offering my talent in the way I can execute that talent to the communities in need. And mission work is one of my passions. And I got to tell you that Sanford has supported me in that mission work tremendously. And also I had the opportunity, for example, this time to bring one of our surgical residents from the University of South Dakota, Sanford, to join me in that trip. And I tell you, those trips are life-changing experiences. Dr. Del Castillo articulated many of the things that she faced as she experienced, you know, healthcare in other countries, and those are real. You know, when a family needs to choose between going to the doctor or eating, or between providing food to them or buying a shirt, or, you know, those are real challenges that we don't face in this country, but others do. So the opportunity to give back in that capacity, to have Sanford back me up in that capacity has been just instrumental. So I grow every time that I have those experiences. You know, you think that you go and help people, your life is the one that changes. It's not theirs, it's your life that changes.
Oh, that's so cool. I really loved, reading that update on my LinkedIn feed, hearing firsthand that experience from you. I can see how it's impacted you, and just so thankful, that you've got the support from Sanford, and really that you can kind of emulate the vision and values of our healthcare system abroad. I think that that's really, really meaningful. I wish that we had more time. As you can see, this topic is so important to us here in healthcare. I feel just so privileged to have spent this time with both of you. Dr. Del Castillo, a special thank you, to the work that you do here in our communities, in our footprint, meeting the needs of our bilingual communities, building trust. Dr. Garcia did a phenomenal job of talking about how important that trust is, right, to getting our Hispanic communities into our clinics for routine preventative health care, cancer screenings. I'm incredibly passionate about cervical cancer screenings in the Hispanic community. We know that Hispanic women are underrepresented in that routine preventative type of health care. And so really appreciate the opportunity to message how important this is, and have the two of you as guests for our Food for Thought this month. Hispanic Heritage Month, as a reminder, takes place every year, September 15th through October 15th. And from the Office of DE&I and myself, I'm wishing you both a very, very happy Hispanic Heritage Month.
Thank you. It's great.
Thank you, Tasha.